Hi, I'm Dr. Shane Howell, and I'm at Alternative Health Management. I'm going to explain a program we do called the Standard Process Purification Program. A lot of people refer to that as like a cleanse or a detoxification program, so it's very similar. Those are just generalized terms anyway. And basically, the program is a 3-week program where you're eliminating all processed foods. You eliminate meat, wheat, dairy for about 10 days specifically, and you're eating a lot of fruits and vegetables. You're doing some smoothies where you add fruits and vegetables to that. And essentially what you do is use a Blendtec or a Vitamix, a very good blender that can kind of pulverize the vegetables and fruit and things like that. And essentially what we do is I add 2 scoops of that to a blender with water, about a cup of water. Then I add some kind of frozen fruit and even vegetables. So this is a good one. I got this at Costco. It's strawberries, blueberries, raspberries, and actually has kale and spinach. And then I usually add, my go-to one is I'll add organic carrots. So the reason why you want a good blender is it'll pulverize it, otherwise it's just kind of a chunky mess. So the reason I use frozen fruit, that way I can avoid using ice, which will water it down. Usually a good idea to add a little bit of essential fats. So flaxseed oil is a good one, a couple of teaspoons of that with that. Along the program, you're taking a few supplements that help assist the liver, the kidney, the digestive system, which are the main cleansing or detoxifying organs as part of the process. So one of them is gastrofiber, which is just a blend of different fibers, selenium, apple pectin, fennel, and fenugreek. Another one that you take specifically only for the first week, and it has a lot of things that's going to help the liver, the kidneys, the digestive tract, and the lymphatic system. And then one you start after the first week is called SP Green Food, which is basically just concentrated kale, buckwheat powder, Brussels sprouts, things like that are very concentrated to help your liver detox, has a lot of antioxidants, things like that. Other things that we might add to the program, depending on the situation, depending on a certain patient might have constipation issues, we would add something like Collinsonia root, so that'll help alleviate that issue. Most people generally do not need that, but just in case. Some people they come into our office having pretty intense sugar cravings, and so doing a program like this, which part of the program is eliminating sweets, sugar, processed foods, which they have a hard time staying away from. Something we use is called gymnema. So that's something they take during the program that can basically eliminate sugar cravings. One of the unique things is if you actually suck on one of the tablets, or if you use they have a liquid version of it, it'll basically eliminate your taste buds for a couple of hours for sweets. So if I suck on this tablet for 1 minute and I try to eat, for instance, a peppermint candy, it tastes like I'm eating a tasteless candy. It doesn't have anything. Or if I try to drink a soda, it'll taste like sparkling water, essentially. So it's pretty interesting to use. Another one, some people need a little extra help with their liver. They've got a lot of congestion in the liver. Maybe you regularly use alcohol or medications. That puts a lot of stress on your liver. So Livco is the one we use. That has schizandra, rosemary leaf, and milk thistle, which are very specific for the liver. And so that's a real important thing to do. So one of the things is, like, why would you want to do this? So essentially, where we during the holidays we eat a lot of processed foods, things like that, drink a lot of wine, around our families, things like that. We would want to kind of get that out of our system for a period of time. And so if you're constantly bombarding your digestive system, your liver, things like that with processed wheat, carbs, fat, alcohol, all kinds of stuff. It never allows that stuff to kind of digest, to metabolize it, and to actually heal. So we want to eliminate that for a time being. Another thing you eliminate for the program 3 weeks is coffee, because coffee is a stimulant, and that puts a lot of stress on your stress handling glands, your adrenals, your thyroid, and also puts some stress on the digestive system. So another benefit that, or reason why people want to do this, is because they have a lot of skin issues. Skin issues generally come from a lot of stress on your digestive system. So eliminating a lot of those processed foods, those wheat, those processed meats, sugar, dairy, things like that, allows the digestive system to heal, and adding all the fiber that you get from the food helps to restore the digestive tract and the normal flora of the digestive tract. That's real important. So some of the benefits of this program are more energy, clearer skin, better digestive tract elimination, better sleep. A lot of people will notice less joint pain, less muscle pain. Some people that have chronic headaches, migraines, usually have it's eliminated altogether. So that's a big deal. People, if you suffer from a lot of those things. So a quick story. One of the first people to do our program was my dad, and myself and my mom, Dr. Paula. We did it all before we started recommending it for anybody. And my dad was trying to get life insurance, and they had to do blood work, and he had elevated liver enzymes, elevated cholesterol, triglycerides, and they would not approve him for some premium life insurance. So he was kind of discouraged. So we all got in this program, and we had blood work before and then blood work right after, and almost everything came down to normal. The cholesterol, triglycerides, liver enzymes, all returned to normal, and he was able to get premium life insurance. So he also had lost over 20 pounds in 3 weeks. He had he's had skin issues, so that kind of cleared up. He had more energy. Another thing that kind of benefits some people is that their mood improves. I know one patient, when she does it with her husband, they both do it together. Her husband is a lot more pleasant to be around, so that's a big deal when he's doing it, because he tends to drink too much alcohol, eat out too much and stuff like that, and those kind of things do affect mood over time. So that's a big deal. So it's a relatively affordable program. One of the important things we try to get across to our patients is see the benefit of food on their overall health, because that's essentially what we're trying to do, is restore and rebuild their health and get them to understand that by nourishing and feeding their body properly, they can actually eliminate a lot of their health issues.